Stroke recovery begins from day one. When patients enter a hospital, the first thing we want to do is to determine if they're a candidate for acute stroke therapy. There are certain functional scores that are done. One is called the FIM, the Functional Independence Measure. That's typically done by the rehabilitation specialist. It's a battery of tests that therapists and physiatrists will do in a patient to help determine what they're able to do and what they can't do. And it really helps target and focus therapy on that patient based on their individual needs. And in addition to that, we do other sorts of imaging, radiographic imaging, such as CAT scans and MRIs. And that also gives us some information and also expectation that we know that if a patient has a small stroke, that there's a good chance that they might have some good recovery with a lot of rehabilitation. At the same time, if patients have a very, very large stroke, then that might also help us set some expectations as to what the patient may experience over the next weeks to months. There's a big multidisciplinary team that's all working in tandem to determine what those patients' needs are in terms of their rehabilitation. Once patients are medically stable and the needs have been determined, then what we start to do is look for facilities or places that can take care of that patient based on their needs. A list is generated and that's provided to the patient and or family or caregivers, and they have an opportunity really to look at those facilities, and once they've decided that a facility is good for the patient, then they let the case manager or social worker know. Once the patient's been accepted, then we get ready to transfer that patient to the next phase of their care. During that transition phase, the providers try real hard to document what the patient's course was in the hospitalization, what the patient's old medications were, what we added, and what they need to go home or what they need to go to the next phase of their care on. Once patients leave the hospital, that's not the end of their care by any means. It's important for them to have appointments not only with a stroke neurologist or a neurologist, but with their primary care doctor, as well as other specialists, depending on what medical problems they have. We provide patient-centered care here. For stroke patients, they are seen by not only neurologists, but we work in the Cerebrovascular Center, a disease-based center where we have stroke neurologists, we have neuroradiologists, interventional neurologists, and cerebrovascular surgeons all working together to treat a common disease. By treating patients this way, they get the best of all specialties.